It's one of the biggest issues facing our youth today, mental health. After COVID upended so many young people's lives, the need for mental and emotional support is greater than ever. Today, in a special edition of Hello Rose City, we'll go in depth to understand and find help for those who struggle. Welcome to this special Healthier Together edition of Hello Rose City. I'm Lacey Evans. We're usually live at 11 a.m., but this evening we are dedicating an entire half hour to discussing youth mental health. It's a show sponsored by Regions Blue Cross Blue Shield of Oregon, which is on the front lines, helping the young people in our community as they face an ever-changing array of mental health challenges. Tonight, we're going to get a full picture of what youth mental health looks like in Oregon. We're going to talk about challenges, but also tips and solutions. We'll also discuss trauma-informed care and how organizations like the Boys and Girls Clubs are helping our young people. We'll also talk about the future and what is being done to train new behavioral health counselors to bridge the access gap. We want to start off by building awareness for what is happening in Oregon regarding youth mental health, challenges, tips for parents, and possible signs that your child may be struggling. With me now is Dr. Mike Franz, Executive Medical Director of Behavioral Health for Regions, and Jamie Vandergaan, CEO for Trillium Family Services. Welcome.
Thank you.
Thanks.
So Jamie, let's start with you before we dive in. Just tell us what Trillium Family Services is and what you do.
Yeah, Trillium Family Services is Oregon's largest provider of behavioral health services for kids and families. So we provide the full spectrum of services from our school-based outpatient programs in over 150 schools in Oregon, all the way through our intensive residential state hospital level of care and every level of service in between for kids and families.
So what are some of the most common mental health struggles and challenges for kids in Oregon?
Yeah, regarding prevalence, Oregon ranks dead last, which means a significant percentage of our population is struggling with a behavioral health condition. In 2021, 40% of high school students stated that they experienced such persistent hopelessness, sadness, and anxiety that they no longer wanted to do things they used to enjoy, things like gaming and arts and sports and being with their friends. And the disparity for our girls is even greater. 60% of girls in that same study reported a feeling of hopelessness, persistent depression, and 25% of that group made a plan to end their lives.
Why are the numbers so alarming here in Oregon?
It's really a struggle in Oregon. Our girls are struggling. We think sometimes the pandemic was just incredibly impactful socially and emotionally and academically, maybe impacting girls at a significantly higher rate. Also for our youth who identify as LGBTQIA, we found on that same survey, 70% of them reported having a significant persistent depression and hopelessness, and 25% of that group attempted to end their own lives. It's so important. If we don't stand up for our kids today, this is absolutely the wake-up call I think we all need to make a change in Oregon.
Yeah, I mean, they just have so much to worry about today.
Adolescence obviously is a very challenging time period. Kids are, their bodies changing, their minds are changing. They're being expected to start to take on adult activities, but their prefrontal cortex, that part of the brain that has not yet totally come online, is still developing. That doesn't finish till the mid-20s. That's the biological component, but then there are these social components going back a couple of decades now that we've really seen push the rise of behavioral health prevalence in the adolescent population. Even going back to the early 2000s with the onset of the smartphone, followed shortly thereafter by social media, and all the challenges of social media. I think we've heard that the Surgeon General's declared a national emergency in regards to that. Kids are really struggling with seeing images that aren't obtainable on social media, the social bullying that happens. Climate change is actually on the minds of kids these days.
Yeah.
They don't know what kind of world they're going to
Yeah.
live in 30 years. The political discord that's occurring in the country, kids are concerned about this. And then COVID, coming out of COVID, the loneliness that kids experience during that, the missed opportunities, the extracurricular activities, the graduations, the dating, all of that has had a significant impact. And then what kids say are most prominent on their mind, their biggest concern is actually gun violence and school shootings.
Wow.
And that's just what they're worried about today.
Yeah. What kind of signs should parents look for?
Well, I think changes in routine are the first thing to look for. So changes in sleep patterns, changes in appetite, certainly irritability. That's kind of an exquisite sensitivity in adolescence if that's spiking. I mean, some irritability is going to be expected, but if you see something markedly different from baseline, that would be a concern. Loss of interest in activities that were previously enjoyable, and then certainly if there's any talk of not wanting to be alive or talk frankly about suicide.
You have some tips on how teens can help themselves in this situation, but these tips also seem great for adults, frankly. Can you talk about those a little bit?
Sure. First I'll start with adults. I think the most important thing is for parents and adults in kids' lives just to be present, to be aware and to show up, be available. Just doing that is probably 90% of it. Listening, doing it without judgment. But if you do notice something, you can say, hey, you seem a little off lately. Is there anything you'd like to talk about? You don't have to dive right into the deep end and ask them, are you suicidal? Although you can, that's okay to do that if you're concerned about it. For myself, I have two daughters. I find it's when we're in the car driving that I get my time when I can start to ask about things because people are kind of distracted.
Sure.
And that's a nice time to do that.
Yeah. Jamie, what about you? Do you have some tips for how teens can help themselves?
Yeah, a real bright spot in the research is looking at positive childhood experiences, which luckily for us parents does not mean elaborate vacations
Yeah.
or theme parks. Positive childhood experiences are really that simple, basic connection between a child, a youth, and a trusted adult, be that a parent, a coach, a mentor, a teacher, can really be any adult in their life if youth doesn't have family in the home that they feel that they can really openly talk about their feelings and really trust that adult in their lives to be there for them and to listen to them. There was a great deal of research in the past on adverse childhood experiences and how negative things that happen to you in childhood can lead to health problems later in life. And it's incredible to know that positive childhood experiences can undo some of that damage.
Yeah. Well, thank you both for being here. It's great work you're doing, and you've painted a great picture for us for this show today. So thank you so much.
Thank you.
All right, coming up next, we'll talk about trauma-informed care and how organizations like the Boys and Girls Club are working to improve the lives of our kids. Stay with us. Welcome back to this special edition of Healthier Together on Hello Rose City. With me now are Jared Short, CEO of Regence Health Plans, and Terry Johnson, CEO of Boys and Girls Clubs of the Portland metropolitan area. Hi there.
Hello, how are you?
I'm good, how are you?
We're doing well.
Thanks for coming. Regence and the Boys and Girls Club have a long-standing partnership. What are some initiatives that you two have worked on together to help improve the lives of our youth?
Well, Regence has been partnering with us in the New Columbia neighborhood, which is where our Regence Club is located since 2007. And we've done a lot of work together to impact the families in that particular community, starting with things that, like back to school events that we've done for families to make sure they have school supplies to go back to school. Also, haircuts and things like that to get ready for school. But most recently, they partnered with us on our Lemonade Day initiative, which teaches kids financial literacy, business skills, and entrepreneurship.
And I'm sure you've enjoyed this partnership.
We have. We've had a long-standing relationship with the Boys and Girls Clubs. In fact, what led to the club in 2007 being kind of founded, if you will, in partnership was a study was done in the 2000 census that identified North Portland as inside of Multnomah County as having the lowest levels of education, the highest levels of poverty, and youth was an area of focus to determine how do we create safe areas, places for youth to come together, and it's been a great partnership ever since. The only examples I would add on top of what Terry said was we annually do this carnival, and it's always a hit with Regence employees and kids and youth, and it's been great.
Well, as we heard in the previous segment, it's not easy being a kid. Some of the challenges they face can take a huge mental toll on them. Regence and Boys and Girls Clubs have partnered up to help those who are on the front lines, those who interact and deal with children every day. And they're the ones who recognize what kids are going through. Can you share more about that, Terry?
Yeah, well, a lot of the work that we do in our clubs, which we impact about 1,000 families, during the out of school time, through our programs. But over the course of the year, we impact 4,600 families.
Wow.
And all the work that we do in our clubs are really built around a trauma-informed care framework. And that's really, looking at how adverse childhood experiences are impacting our youth. Okay. And, those experiences, those negative experiences can be things like, verbal or physical abuse. It could be domestic violence in the home. It could be neglect, or, it could also be loss of a parent or caretaker. And so we work with families and with our youth in particular to understand what their lived experience is and how those ACEs have impacted them. And then we find ways to help them heal that trauma, and working with them individually to point them to the resources that could help them work through it.
Wow. Yeah, what are you seeing on the front lines?
In addition to what Terry mentioned, if you think about it, imagine you're an elementary kid and you're worried about food. You have food security issues, or imagine that you're a teenager and you're homeless. There's 3,000 homeless families in Oregon that have kids, and that's something that creates just incredible strain and pressures. Or to Terry's point, you have a home, but you don't feel safe in your home. And so those are all areas that we continue to monitor and look in terms of finding ways to partner and create new opportunities, and we continue to do that with the Boys and Girls Club.
If a young person does come forward, tries to seek help, what are some challenges or gaps they might encounter?
Right. Yeah. A lot of times, we see kids really struggle with, feeling isolated, feeling a sense of despair, feeling a sense of hopelessness. And our partnership with Regents, really provides, the investment in infrastructure to help kids work through that. The single most impactful thing on a youth's life in terms of their mental health and their social emotional development is a positive one-on-one relationship with an adult mentor. And the investment that Regents puts into our organization helps us provide what we call our Youth and Family Supports Framework, which really drives that trauma-informed care model that we operate around. And so our Youth and Family Support coordinators have a relationship with every kid in the club, as well as the whole family as well.
Wow.
So we're looking for some of those issues and indicators that are coming up where youth might be struggling, but also working with the families to provide that wraparound support to make sure, that they're able to work through some of the issues that arise.
Before we were talking before the show, and you said the first Boys and Girls Club opened in Portland in 1954.
1954.
I
yes.
bet it looks a lot different than it did back then, right?
Right?
I mean, you're doing great work, and we appreciate you both coming on to share your experiences. Thank you.
Yeah. Thank you.
Thanks for having us.
All right, coming up, we'll talk more about the access gap and the innovative ways Cambia Health Foundation and the Balmer Institute are trying to close it. We'll be right back. Welcome back. To make sure young people are able to access all the mental health services they need, there needs to be providers in place. And my next guests are making that happen. With me now is Dr. Katie McLaughlin, Executive Director of the Balmer Institute, and Peggy McGuire, President of Cambia Health Foundation. Welcome.
Thanks for having us.
All right, let's talk about accessing behavioral health care. One of the reasons access is so restricted is due to a lack of providers, right? So Peggy, what is Cambia Health Foundation doing to support the workforce?
Yeah, thank you for the question. It's a huge issue. People who need help have trouble finding it. That's because people are leaving the profession due to burnout, and then not enough people are entering. So we have a three-pronged strategy, if you will, for dealing with this crisis. One is to support the existing workforce. Two is to look for new models of care that expand what we think of as the workforce. And three is to support students who are from diverse backgrounds who want to enter the healthcare profession. So in terms of our first prong, supporting the existing workforce, think about last year when we rolled out the 988 dialing code. That's for the suicide hotline. It's a national code. Calls have increased significantly since that code was put into place. So we invested in a couple of local nonprofits to help them hire additional staff train that staff, and then support the staff with self-care. So, we always talk about helping kids, and that's very important, but we also have to help the helpers.
Yes, yes. And Dr. McLaughlin, before we dive into you, tell us about the Balmer Institute, because it's a new program and I wasn't fully aware of it.
It's a brand new training program. It's actually the nation's first undergraduate training program in child behavioral health at the University of Oregon. That training is actually going to happen right here in Portland on the new University of Oregon Portland campus in the Concordia neighborhood.
Very cool. And you are taking an innovative approach when it comes to educating behavioral health professionals. Tell us about it, and then what makes it so different than what's currently being done?
So the vision of the Balmer Institute is that access to high quality mental health support should be a fundamental right for all children and families. Now, accomplishing that vision requires that we expand the behavioral health workforce to meet the growing need for support among children and adolescents. And that really requires new approaches. So our training program is novel in several ways. So first, our hope is to expand the behavioral health workforce by providing the kinds of training that have typically only been available in graduate degree programs at the undergraduate level, meaning that our students will be ready to enter the workforce sooner. So second, our program prioritizes the needs of youth who have been historically and persistently underserved by the behavioral health system, and is going to be shaped by input from parents, educators, children and adolescents, and local community organizations to ensure that our training model is aligned to the needs of the communities that our students are going to serve. And finally, our training program emphasizes training in early identification of behavioral health problems and the delivery of interventions that are designed to prevent those problems from worsening over time. And that's really a distinct focus from existing behavioral health professions. So we are building this in partnership with local Portland area public schools, where our students will deliver interventions to promote well-being and prevent the onset of youth mental health problems in students. And although this is a novel approach in the US, this work was inspired by global work that demonstrates that training individuals at the bachelor's level is not only effective, but can greatly increase access to care. So our hope is that it will similarly increase access to care right here in Oregon, and eventually the entire nation.
Yeah. Peggy, can you expand a little bit on finding non-traditional ways to support the workforce? What do you mean by that?
Yeah, and it's kind of new models of care. Traditionally, we've thought of behavioral health separate from physical health. So one of the things we're doing is working with organizations to embed behavioral health into the physician's office, into the primary care office. Virginia Garcia is one of our partners, and we're helping them to look at their workflows to see how can we really meet kids where they are when they come into the doctor's office, have the doctor be able to say, screen for behavioral health issues and treat that whole child. We're also investing in a lot of school-based programs and school training. So when, the teachers and the paraprofessionals are often the first, line of defense when it comes to seeing what kids need and whether they're in trouble. So we're providing some training there. And then you heard Terry and Jared talk about the trauma-informed care at the Boys and Girls Club. We're also partnering with Latino Network to help them certify behavioral health coaches to work in schools. And then we're working with Friends of the Children to provide training to their mentors who work with kids.
Yeah. Well, it's so interesting to learn about and hear about. So thank you for coming on and sharing your experiences. We appreciate it.
Thank you for having us.
Thanks for having us.
We'll be right back with more of this special edition of Healthier Together on Hello Rose City. Don't go away. Welcome back, and thanks for joining us for this Healthier Together episode of Hello Rose City. Throughout the show, we've been sharing ways to help youth cope with stress and to improve their mental health and well-being. One of the messages we hear again and again is communication. If a young person you know is struggling, talk to them. Open and honest communication is key. And we know teens aren't always the best at communicating, so watch for those nonverbal cues, a change in personality or their physical health. And most importantly, find help. We've talked about some of the challenges in getting help, but also the nonprofits, programs, and experts who want to see our young people thrive. Bottom line, it's going to take everyone working together to help youth facing mental health challenges. We really appreciate all the guests who've joined us for this important conversation, and thanks to you for watching. Have a great evening. We'll see you next time.